Hi, this is Tristan Moore. I'm a volunteer with the International Autoimmune Arthritis Movement and an autoimmune arthritis patient. This presentation is titled Autoimmune Arthritis and Eye Health. Because I am not a licensed healthcare professional, I have to show you a disclaimer. The World Autoimmune Arthritis presentation is designed, I can't see my presentation. Is designed to provide accurate and authoritative information from a patient's perspective. By giving you this information, we are not giving any form of medical advice or recommendation, and we do not intend you to rely upon it when making or refraining from making any decisions in regards to your medical care. As always, speak to your doctor or get a licensed healthcare professional to provide you official medical advice. The purpose of this presentation is to deliver a brief patient-to-patient overview of autoimmune arthritis diseases and eye health in general. My goal is to spread awareness among the autoimmune arthritis community, the importance of paying close attention to your eye health. I did want to make a brief mention that I am a spouse of someone that is blind. So my household is personally affected by blindness, which is another reason why I had personally wanted to create and present this presentation. Okay, so what exactly is autoimmune arthritis? Autoimmune arthritis was designed by IAEM and a rheumatology board as being chronic systemic inflammatory autoimmune diseases primarily affecting the joints. Autoimmune diseases currently classified as autoimmune arthritis is RA, psoriatic arthritis, ankylosing spondylitis, primary Sjogren's syndrome, systemic lupus erythematosus, Still's disease, juvenile arthritis, mixed connective tissue disease, undifferentiated connective tissue disease. These diseases are caused by a malfunctioning immune system, while joint involvement excuse me, is a primary factor. Because they are systemic or whole body, they affect other connective tissue they affect other connective tissues, organs, and various parts of the body as well. Eyes are obviously one of them. Let's see. Multiple ways that autoimmune arthritis diseases can affect the eyes. This is not a complete list. I'm missing a... there we go. This is not a complete list, and it is impossible to cover all of the possibilities here. One of the big ones is uveitis, which is swelling and irritation of the uvea, or the middle layer of the eye. The uvea provides most of the blood supply to the retina. Aggressive treatment of uveitis is imperative to prevent vision loss. JRA, RA, and Sjogren's patients are at highest risk of developing uveitis, though uveitis can potentially be seen in all of the autoimmune arthritis diseases. Symptoms of uveitis are blurred vision, floaters, and redness and irritation. As some patients I've been told, and I've actually seen some pediatric patients specifically, sometimes the first presenting symptom that they have in autoimmune arthritis disease is uveitis. Glaucoma is inflammation inside of the eye which can affect the eye's drainage system, leading to glaucoma, a condition that can result in blindness. Depending on the type of glaucoma, signs and symptoms may include slow vision loss, blurred vision, or eye pain. Cataracts, that's the clouding of the lens of the eye. Dry eyes in autoimmune arthritis is common either as a direct result of the immune system attacking the tear-producing glands, like in the case of Sjogren's, or as a side effect of medicines. Dry eye is common. Dry eye syndrome can lead to problems with the cornea and other tissues in the eyes, so it is important to communicate dry eye concerns to your eye health care professional. Sometimes people just look at dry eye as just a inconvenience, but it really can have more serious consequences if it's not treated. Medication considerations. Some medicines for autoimmune disorders may have adverse effects on your vision health over the long term. Some of those are corticosteroids. Long-term use can cause cataracts and increase the risk of glaucoma, and antimalarials. Plaquenil occasionally build up in the retinas, causing some decrease in vision. Both of those tend to be controllable, provided that you're seeing your eye health care professional on a regular basis. Let's see. Signs and symptoms that you should discuss with an ophthalmologist or your rheumatologist is red eye pain, decrease in vision, dry eye discharge, or blurry vision. One of the take-home messages I do want to make sure I impress here is that many eye diseases are actually silent in the earliest stages, and you don't really notice vision loss until later stages. Again, this is why it's so important that you have regular eye checkups, especially if you are diagnosed with an autoimmune arthritis disease. That way you can prevent as much vision loss as possible. I made an additional slide here on more resources that you can go look up to see more specifics on how autoimmune arthritis disease can affect your eyes. This slideshow should be uploaded to the resources section on the World Autoimmune Arthritis Day site, so that when you download it, you should just be able to click on these links. I did find all of these particularly helpful and very interesting in my research for this presentation, and I hope that it helps you. A note on blindness. More than 1 million people age 40 or older are legally blind, defined as a 2200 best corrected vision. With upwards of 4 million Americans suffering from Sjogren's, it is one of the most prevalent autoimmune disorders. 9 out of 10 patients are women. I thought that was pretty interesting. And also of note here is that a lot of times I have found that patients with autoimmune disorders have a lot of overlaps. So a lot of times you see a lupus patient also have Sjogren's, or you may have an RA patient with Sjogren's, and sometimes it seems like those diseases come in pairs. Let's see. So the best way to prevent blindness and irreversible effects of eye diseases or complications of autoimmune arthritis in the eyes is to follow your physician recommendations based on your situation, or get baseline eye exams at disease diagnosis every 6 months following diagnosis, especially if you're taking medications, or if your autoimmune arthritis disorder specifically has an increased risk of eye complications. Every 3 months if you already have a history of eye complications. Children with autoimmune arthritis, I believe, should have a checkup at least every 3 months following initial diagnosis until it is ruled out that they don't have any of the eye complications of autoimmune arthritis, and then let the physician recommend a schedule from there. Obviously, you want to visit an ophthalmologist at any onset of symptoms listed in the earlier slide. While I provided you a list of signs and symptoms of eye health complications, it is important, again, to understand that there are many disease processes of the eyes that are silent and not obvious until later stages, when treatment can be more challenging. Because of this, I cannot stress enough the importance of regular eye exams, regardless of whether or not you're experiencing symptoms. Let's see. This is a kind of a lead-in to some of the specific pediatric considerations. Uveitis is responsible for up to 20% of all blindness and I got that from the American Uveitis Society. I thought that was very interesting, and obviously again brings home the message that why it's so important to have regular eye exams. In order to detect eye problems early and prevent them from causing damage, your rheumatologist, a doctor who specializes in treating arthritis, will schedule frequent appointments with a pediatric ophthalmologist. The pediatric ophthalmologists are medical doctors who specialize in diagnosing and treating eye diseases, specifically for kids. Sometimes it's challenging to get kids to sit still during eye checkups, and kids have a harder time expressing or recognizing symptoms of vision problems. Pediatric ophthalmologists are kind of specialized in identifying and treating childhood-related eye diseases. I spent a lot of time myself needing eye care growing up, and the difference is pretty significant when you take a child into a ophthalmologist that specializes in pediatrics versus general ophthalmology. Some presentations that are taking place at the World Autoimmune Arthritis Day convention that may be useful here is Coping as a Parent Living with Autoimmune Arthritis. That's hosted by Squeaky Joints leader Bridget and Peggy. And also Tips for Parenting a AJA or Juvenile Arthritis, hosted by parent bloggers Danielle and Stacy. All of those wonderful volunteers, I can't wait to see their presentations myself. They've done a lot for our community. Also, with the pediatric considerations, I wanted to just point out that parental support is kind of paramount, especially in this day and age. There's a lot of groups out there where there's parents that have already dealt with uveitis or other side effects of autoimmune arthritis and its effects on the eyes. No need to reinvent the wheel. Get out there and connect with those parents, and they'll oftentimes point you to resources in your local community you may not even know exists. Let's go on to the next slide. This is another one of those did you knows. According to American statistics, 50 years ago, nearly 50% of children diagnosed with uveitis permanently lost their vision. Today, 88% of children retain their sight if they are diagnosed early and receive the correct treatment as soon as possible under the care of a uveitis specialist or pediatric ophthalmologist. This basically just brings home the message that how important it is to have early diagnosis and intervention of pediatric uveitis. With that said, a lot of parents where I have met have been very on top of that, and not all the time did early intervention work, but a good majority of the time it will provide the best chance at preventing blindness and other problems associated with aggressive uveitis. Let's see. Again, this presentation should be downloaded to the resources section of the World Autoimmune Arthritis Day convention site so that you can click on these links, but I included some additional links that I thought would be useful for adults as well as parents of children that are affected by eye diseases related to their autoimmune arthritis. In addition, some of the links that I provided here can help point you to resources if you're having problems accessing eye care or getting glasses or getting some of the treatment that you need. Lions Club is an example of an organization that oftentimes will help parents and patients reach basic eye care exams and corrective lenses. Thank you very much for tuning in to this patient-centered presentation. I hope that some of the information has been useful, and please feel free to ask more questions in the chat sessions. Have a good day.